What if I don't know what to say? Well, the great news is you don't have to think of something to say. If you feel like things are going well, that's great. Sometimes it's nice to talk about the positive things too in your session or in your appointment. What's going well? Because we want to capitalize on that for you, right? What are your strengths? What's going great? And we can use that to strategically think about some of the weaker areas in your life so we can beef them up, right? I don't know if you've seen like that wheel of life and all the different categories in your life with social support and finances and work and family and all of the things in self-care, right? Where are you really strong and where are you weak at? Sometimes it is, you don't have to come in with something bad to talk about. You don't have to come with a big traumatic story. You have to come in with a mood disorder and say, I just really have these horrible thoughts. Sometimes it's nice to just get a different perspective on like, hey, I am really killing it in my relationships, but work, I just struggle. Okay, let's talk about that. Or vice versa. If you're killing it at work and you struggle with close, intimate relationships, whether that's with a significant other or with your kids or with family or with friends or with coworkers, then let's talk about that. What does that bring up for you? So I think the goal of therapy and psychiatry is really to help you feel like the best version of yourself. So please don't worry if you come in and you're like, I'm here and I don't know what I want to talk about. We will find things to talk about. And like I said, it doesn't have to be negative, right? We get so used to bonding over negative things in day-to-day life, right? Especially at work. Oh, we both hate the boss. We both hate corporate, right? Or at home. Oh, I hate my husband. You hate your husband. Great. We hate our husbands, right? Our kids are stressing us out, right? We bond over negative things so much in life. And really, it's more meaningful and these connections last a lot longer in life when you bond over positive experiences, more so than the negative ones, because the negative ones are going to fall away. Most of the time, negative circumstances in your life will not maintain forever and ever. But the positive ones that you build on with other people, those are the relationships and connections that last a really long time. So it's really important that we have that opportunity in our life and also with providers to really talk about, hey, these are the things that are going well for me. These are the good things in my life. These are the positives. And here's a couple of weak links, but I feel like pretty good. You know, your provider, your therapist, your psychiatrist, if you're doing really well and you really don't need our help, then we're going to tell you, I don't know what you want me to do for you. You sound like you're doing amazing. That's great. Then, you know, peace of mind, then you don't need to go forward. That's fine. But sometimes it's nice to talk about the positive things too and learn to look for those, seek those out, and connect with others on a positive note as well.